All right, very good. So, hello everyone, Dr. Rich Castellano here, the Smile Doctor. We're here today with Lynn. Thank you very much, Lynn, for letting us share your procedure. Lynn is doing a lift under local anesthesia, and we already did some of the numbing medicine. Do you feel that your face getting a little bit more numb there, Lynn? Yeah, it feels goofy, and so she won't feel a thing really at this point. Lynn just had some advanced aging changes, so we're going to do some tightening things up, and I'm really excited about her results, that we get the sun damage to the skin. And so now, today is Lynn's day, and so Lynn, what we're going to do is we're going to start out with the laser, and I'm just make a little adjustment here, and you'll be done before you know it. And so we saw Lynn in consultation, and we went through things with her, and she's had some of the relaxing medicine, and that sneaks up on us. And now that we've done the numbing, that's the worst part of it. The rest is really a piece of cake. I'm going to move this right over here. Perfect. So we are in Tampa and in the Villages, Florida. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. And doing facelifts under local anesthesia really is preferred nowadays because people don't want general anesthesia or IV sedation, and they don't want to have an extreme result, so they're looking to get the best result that still looks natural. And so, Lynn, you were mentioning you were waiting a while to figure out before you decided to do your lift, and what was it that made you feel comfortable and said, okay, now I'm ready to do it?
I guess I just got tired of looking at the wrinkles.
Okay.
I wanted them gone.
Okay, so we're going to focus on that today. Now, what we're going to do is we're going to put these little eye shields.
Good.
So close your eyes for me, and then the little eye shields protect. We're going to turn the laser on. I've already done all the numbing medicine through this area. Thank you for watching, and thank you everyone for sharing. Para mis pacientes, hablas español, por favor llamar a la clínica 813-463-9245. Hablemos español. Y yo puedo viajar de website ImageLift.com. Feel a little pressure through here. So now, this is just the submental incision, and this is where we're going to do the laser treatment, plus we're going to do a little bit of tightening as well. Everything's looking good. Thank you for sharing. Muchas gracias para como partido. Make sure you share, because your friends are going to be upset if you tell them you were watching a live procedure. Did you feel a little pinch there?
No.
Okay. And then you didn't share it with them, so let them know. And it is amazing what we can do today with our recording
Please just make
studio.
it very tight.
We are going to make it as tight as possible.
I don't want to have to do this again.
There you go. Joan Rivers used to joke that her face was pulled so tight, if she sat down and crossed her legs, her mouth would pop open. So, but we won't let that happen. But we'll go for the gold.
I had an aunt who had so many facelifts, she had a goatee.
Oh, that's funny. That's yours. There you go. Our patients are the ones telling the jokes now. So, I used a little laser tightening, and we use the shields to protect. Lynn is closing her eyes, and I only activate that laser when it's in a safe place to do so. Are you feeling any pain here, Lynn?
No.
Everything's looking good. So this is laser lipolysis, the Cynosure triplex. 1064-1320 wavelength. It removes some of the fatty tissue and creates a heat injury under the skin. And we found this is helpful because we lose the elasticity in our skin, and you want to help tighten the skin as best you can, while the lift is going to tighten the muscle and remove the extra skin.
Well, the next we do my arms.
All right, yeah, we're going to have to reach a little further underneath the drapes. So everything's looking good. I'm very happy with how things are progressing. We monitor heart rate and blood pressure and oxygen, but most importantly, we monitor Lynn, and we ask Lynn how she's feeling. And if she feels a pinch, we can give her a little numbing medicine. But right now, she really should not be feeling much of anything. And that's the way it's designed to be. So thank you for watching. Thank you for sharing. Make sure you're also looking at our Instagram page, ImageLift Now on Instagram, Dr. Rich Castellano, and on YouTube, ImageLift.com. or youtube.com/ImageLift, and on Facebook, facebook.com/ImageLift. We are really excited about our event that's coming up. It's going to be at the Tampa Convention Center. We have doctors who are flying out from all across the country. To learn more about what we do, go to practiceprofitabilitymd.com so you can see how we train other doctors to take great care of patients. That's practiceprofitabilitymd.com. It's going to be at the Tampa Convention Center. You can get CECME credit. Very good. Thank you for watching. Thank you for sharing. If you like what you're seeing, please do share. People want to know what their options are when they're doing facelift treatments. And a lot of people are unaware. I just saw a patient today who spent $16,000 on neck tightening procedures that were non-invasive. I mean, she spent a lot of money, but it felt like she had almost no results. We deliver results with what we're doing here because, you know, this is, you feel a little pinch there? So she feels a little pinch. Then what I do is I'll do a little bit of numbing there. Are you feeling any pain right now?
Not pain, just that little pinch.
Yeah, that little pinch, and so I'll numb it, and then it's going to go away. Perfect. So we deliver results that the no downtime treatments, sometimes they can leave you wanting more. And so if patients, you can do the no downtime treatments if you don't mind spending the money and you get little or no results, but this is something that's going to deliver results. If you're interested in pricing, go to ImageLift.com/pricing, and you can see all of our pricing there. Or come to one of our events, ImageLift.com/events. We have awesome events. Our patients come out, you see our models, meet our staff, see our before and after pictures, get a copy of our book. You can go to ImageLift.com/ or go to Amazon and download our books. We guarantee we can make you look younger, and the Smile prescription. They're under my name, Rich Castellano, MD. For those of you just joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Thank you for sharing and thank you for watching. Muchas gracias para como partido el video. We have a lot of Spanish speaking patients in our practice. We're in Florida. All right, so once I do the lift, I'll have patients come back to the office 1 day, 1 week, 1 month, 3 months, 6 months, 9 months, and that is the normal follow-up. Some people will come in more often, and some I don't see them for a while. But as long as you know you're supported, I do like to follow up, make sure everything's going well. We do have some flexibility in those follow-up dates, especially for our out-of-town patients. We might be following up via phone. Temperature, please. Everything's looking good. So the basics of what we do, if we sag, then we tighten. There's 4 areas we treat. We tighten for sagging skin, that's what we're doing today. We restore volume and fill. If we lose volume, and we did some of that, the Sculptra and the Bellafill today. And we would like to thank Geneva Medical and Bellafill for supporting our events and also supporting our patients. And then we also can retreat the skin, polish and repair the skin, sun damage, wrinkles, and sunspots. But the 4th thing we do to our face looks better than everything else, and that's our behavior. None of our treatments look as good as Mother Nature's free facelift. When we smile, Lynn knows the power of smile. She's a good smiler. Lynn, where do you feel you get your smile from? Were your family big smilers, or?
Yeah, they were a rowdy bunch.
Okay, good. Well, that's good for our personality, temperature through here, and for our sense of well-being and sense of humor. Good. Show me the highest. That's good. So, 4 areas we address. Then there are 4 rules for good plastic surgery. Safety first. You must look natural. Prevent future aging changes. And let's give them as much improvement as possible. Perfect. We have our webinar that's coming up soon for the physicians and students that are watching. We show people what you need for your consultation basics. It is a powerful webinar. It's coming up soon, so let us know if you're interested. And that is going to be, we're going to be setting the date for that soon. We finished all the content. Temperature, please. Very good. Thank you for watching and thank you for sharing. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here today with Lynn. Lynn was generous enough to allow us to share her video as a teaching video. Hi, Eve. Thanks for watching. Eve says, ouch. Are you feeling any pain at all, Lynn?
No.
Lynn does not feel any pain. Lynn, do you mind if we share how young you are?
Go right ahead.
How young are you, dear?
I'm 74. I'll be 75 in January.
This is not the picture of a 75-year-old. We are living longer. You're an inspiration, Lynn. Temperature through here. Very good. So a little bit more with the laser. I monitor the laser with the temperature. We have a temperature gauge. I feel it with my fingers, and then I also monitor the temperature. The energy. I monitor the energy that I give through the device. So the energy, the temperature, with the external monitor, and then the temperature I feel with my fingers. Everything's looking good.
And this will get rid of the sagging down the left and right side.
It's going to help improve it, and then we're going to tighten the muscle as well.
Oh, good.
So we're going to do all of those things. Very good. Just show me the highest. So we are in Tampa and in the Villages, Florida. You know, today patients just want to understand their options, and we're here to share that with you. There's a new Botox coming out called Jeuveau. I met with the Jeuveau representative. Hi, Kayla. We are doing an ImageLift facelift under local anesthesia. Temperature, please. Good. Thank you for watching, and thank you for sharing. Para mis pacientes, hablemos español. Llamar a la clínica. Y muchas gracias para como partido de video. And so the best part about what we do is the patients we get to spend time with. You know, that makes it interesting for us. Some people say, well, you only do faces all day long. Don't you get bored? But we don't get bored because we get to see Lynn. I get to spend time with my staff. They're the best people I know. There's a lot worse places you could be than here, so we're enjoying it, and I love that we can make a transformation for patients who they come to us and say, you know, I've been having this challenge, or I've had these wrinkles for such a long time. Can you help me? And that's what we do best. So it's very gratifying to be in that position and help people with what bothers them. Now, of course, our personality outshines any physical feature, so that comes first. But we can help people look a little younger. Now, of course, we never see ourselves the way that other people see us, which is fascinating. You know, we're looking at the same thing, but how come we don't see ourselves the same way? And the answer is because when we look at ourselves, sometimes we can be a little hard on ourselves. And when we look at other people, we're just glancing at them. And they're moving, they're social. But when we look at ourselves in the mirror, we don't glance. We stare and we glare.
And we study.
And we study. And if you look that way at another person, they'll say, what are you doing? Don't look at me like that. So we should not look at other people. We should not stare and glare at them. And we also should not stare and glare at ourselves. ¿Cuánto tiempo el duro es procedimiento? So the procedimiento duro 5 or 15 años, dependiente cualquier tú tener ayudar. It depends on how you take care of yourselves. Genéticos, genetics, to comer, the food you eat. So if someone asks how long does it last, people usually wait 5 to 15 years before they say, maybe I'll do another lift. Muchas gracias para como partido de video. But the longevity, people do wait many years. Sometimes people come back in a year or two and they want to touch up, and sometimes people wait 20 years. Denise said, is she asleep? Are you asleep, Lynn? No, she's not sleeping, but she doesn't feel anything. Now, we gave her some Valium not too long ago. If we need to give her more, we will. But this is how the procedure is going to go. She's going to feel nothing. And in a little bit, I'm going to ask her if she wants more relaxing, but I like to give it some time for the first relaxing medicine to settle in. And we're going to start doing some stitching here as well and tightening things up. Thank you all for watching. Thank you for sharing. If you're just now joining, I am Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon. You can look up our books on Amazon.com. They both hit the Wall Street Journal bestseller list, The Smile Prescription, and we guarantee we can make you look younger. Come out to our events, ImageLift.com/event. We have a lot of seminars we put on, and you can find out our pricing. ImageLift.com/pricing. Para mis pacientes, hablemos español. Yo estoy Dr. Rich Castellano. Llamar la clínica 813-463-9245. That's 813-463-9245. Lynn, how are you feeling, dear?
Fine.
Very good. So we're done with the laser now. So then what I do is, these are the cons, okay, and I'll use this just to elevate the skin. And as you can see, there's really no significant bleeding because when you're in the right tissue plane, it's not something you have to worry about. You might cauterize a little blood vessel here and there, but that's the beauty of choosing someone with a lot of experience because you want to do things the right way. I've done over 4,000 facelifts under local anesthesia. You get the hang of it after a few thousand. And a lot of doctors will retire after doing 500 or 1,000 facelifts, but this is all we do. And people ask if I do body. Now, not really, but if I do the face and I pull really, really tight, sometimes I get a little tightening in the tummy and down below. I'm just kidding. But we just focus on this. Yep. Yep, very good. Thank you for sharing. Ada said she had zero pain. So thank you for watching. Thank you for sharing your comments, and thank you for sharing the video. Make sure you share with your friends, because if you tell them you're watching a live video on Facelift, they're going to say, well, how come you didn't share it with me? So I would go ahead and share it now. That way we can spread the word, because people are a little overwhelmed and confused. There's a lot of misinformation. How you feeling, Lynn?
Great.
Stiff. You'll feel a little bit of the stiffness because of that numbing medicine. Right. It makes it harder to move your lips. But you're doing great, and you are going to love your results.
My biggest one is the lines that come down from my nose. Those deep lines.
Those little bunny lines?
Oh, I want to get rid of those so bad.
All right. Well, we're going to work on these, and we're going to do the very best we can. So, all right.
Yeah, I know they're pretty deep, so it's going to be hard.
Everything's looking good. A little bit of a bright light here. Perfect. So I'll use the gauze. It gives me a little more visibility. Perfect. And then I'll trim a little bit of the fatty tissue. There's not really that much, but we just take things down to the level of the platysma muscle.
Whatever that may be.
That's for me to know, and for Lynn, she doesn't have to worry about it.
Exactly.
I went to school for that, so she can just relax. There you go. Very good. People ask, what does it mean to be double board certified? So, to be board certified, you have to submit your case logs to an accrediting body, and they will review your cases, and then there's an oral exam and a written exam that I take. Perfect. Okay, so I've trimmed a little bit of the fatty tissue. I'm going to trim a little bit more on this side. Thank you for watching. Thank you, Marlene. We are located in Tampa and the Villages. We have Caitlin, our nurse injector, who's out at the Villages, and she has a few really great specials on her fillers. My schedule is so busy that when people need to get in straight away, they can just go see Caitlin, and she's been wonderful. Patients really love her. Perfect. Everything's looking good. So now I'm going to do some stitching. This is called the corset platysmoplasty, where I take the 2O Merceline, or it's an Ethibond, and this we use to tighten the muscle. So you'll feel it get a little tighter under here, Lynn. That's what we're here for. And thank you to my team, Ari and Nina and Charlene and Lainey. They have everything always set up perfectly for me. Makes it very easy. Thank you, Ari.
It's my pleasure.
We are so proud of our team. We get a lot of compliments on our team. One of our patients called Ari Mrs. Santa Claus because she said she was so nice. And she's just as nice as Miss Santa Claus. That was really sweet.
Very sweet.
Yeah, our patients are well taken care of, and I'm well taken care of too. Okay, good. So, okay. So we grab the edges of the platysma muscle and we stitch them together. When people are doing facelift procedures, they just don't want to go too far. They want to look natural. They want to make sure that they get a nice improvement, but you don't want to cross the line and go too far. It can be difficult to deal with. That's why people come here, because they trust experience, they trust our track record. We're so grateful to our patients and all the kind words that they say about us. And I've dedicated my career to this. So I've been preparing my entire life just so I could do a great job for Lynn's facelift. And the day has come. We are here to do this. So it is a true honor, a sacred honor. Okay, so very good. So now that I have stitched this area down, I'll trim the knot. Someone is in Spanish has a question about what wrinkles are eliminated. Arruga acerca de todo la cara es más suave después. No puedo quitarse todo de arruga. Muchas gracias para tu preguntar, pero tú vas a mirar natural, es muy importante. Y por favor llamar a la clínica para de preguntas al dentro español. Mi clínica hablemos español. Y muchas gracias por como partido de video. Thank you for sharing. Thank you for watching. Yo viví al dentro Ecuador 3.5 semanas y practicar mi español. So I lived in Ecuador for 3.5 weeks, and that's where I learned my Spanish. So I practiced my medical Spanish as best I can, and then with my Spanish-speaking patients, I get to practice a little more. Release for me, please. So that's looking really good. I'm going to turn your head all the way this way, nice and easy. Very good. How are you feeling, Lynn?
Fine.
We will be rebroadcasting later, so make sure you are watching. So this is my 15. Make sure you are also following so you get the alerts. Hi, Santiago. We did some of the smart lipo. However, that's in combination with the lift, so you'll feel some pressure. If you feel any pinching, you let me know. Very good. Perfect.
And this is where you pull it from?
We're going to start pulling. Yep. We're getting there.
Oh, please, those ugly lines go away.
Be nice to Lynn. Don't be too hard on Lynn. It's not easy. We change. Our appearance changes as we get older, but
I know.
aging, it's better than the alternative.
That's what they keep telling me.
Okay, ear forward, please. So now I'm doing traction, counter traction for the physicians and students that are watching. And we're lifting the skin through here. And you can see there's a little bit of scar tissue from previous procedure, and that's okay. That's to be expected. Very good. Perfect. Everything's looking good. Thank you for watching and thank you for sharing. It is so helpful when you share because it allows us to, and we don't need those, we're done with
That's
those.
okay.
Yeah, we're done with those.
Don't worry.
I know.
And so it is helpful to share the message because, you know, people just don't know what their options are. And
And talking about facelifts to most people is very scary.
yeah,
They get very nervous.
that's true. That's why we show this so people can say, oh, well, she's not having pain and that's something I could do and the results are so good. So that's why we share it. That way we have the fear of the unknown, but there's no better way to understand what you're doing than when you see a video and say, there it is. Now, it's not for everybody. Some people don't like to watch those types of things, right? My wife, she doesn't like to talk about medical things at the dinner table, so she won't ever watch something like this. But patients want to know, so we put the videos out there. Very good. Thank you for watching. Thank you for sharing. So we are in Tampa, Florida, and in the Villages, Florida. We will be rebroadcasting later, so make sure you are following and you have your alerts on. Now, when we get a little bit of sun damage to the skin, I'm always cautious on how you redrape the skin so that it lays nice and flat. That takes the artistic eye and a lot of experience. And we have a consultation with all of our patients in advance to say, we do our best to set the expectation. Some people want more, some people need more. So here I can lift, you see everything, and then we pay close attention here when we're pulling back. You can see how that changes the nature of the lift. So go ahead,
Give
Lynn.
me Elizabeth Taylor's face. I don't mind that change.
Okay, well, coming right up. We'll do Elizabeth Taylor. Here we go. You're funny. Okay. And so, see, that makes it so worthwhile that we just have the best patients. And see, I'm working so hard right now, right? This is not hard work for me, right? It's a joy to be here. I love doing surgery. It's like a little meditation. I get to spend time with my awesome team, and we have the best patients. So I love my job. Very good. Exposure for me, please. So again, we're using the 2O Merceline, and I'm going to be doing some tightening through here. Perfect. Very good. That's fine. There's enough. So you feel like get a little tighter here. And then we cinch things down. Now, for the physicians and students that are watching, once we cinch things down, you're gonna clamp it down. We call this flashing with the hemostat. And then when I move it back and forth, I'm cinching that knot down. Cinch, cinch, cinch. Yeah, just gotta go straight on the knot there. Perfect. Okay. Thank you for watching and thank you for sharing. Good. Take, please. So now once we do the tightening, then I'm going to undermine just a little bit here. Perfect. Everything's looking good. Okay. I'll take it right now. Okay, thank you for watching. Thank you for sharing. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here today with Lynn. Lynn is doing a ImageLift facelift under local anesthesia. I'm using the 2.0 Vicryl for the preauricular SMAS plication. Perfect. Cinching down this knot. Perfect. Okay, so once I do that, now I'm going to be perfect. So you see how that improves in that area. Someone said, how long does it last? Some people wait 5 to 15 years before they say maybe they'll do another. Some come back after a year or two, and some may wait 20 years. It depends on how we age. It depends on how we take care of ourselves. It's like getting 5 years or 40,000 miles, 50,000 miles out of your tires. It depends on how we drive our car. Perfect. So we trim away some of the extra skin here. Just undermining the skin right in these areas here. And then I'm going to release the ear a little bit here. And then that's a little bit more normal positioning for the earlobe. Thank you for watching and thank you for sharing. We'll see Lynn back 1 day, 1 week, 1 month. Exposure, please. 3 months, 6 months, 9 months. And I'm doing a little bipolar cautery just to seal the blood vessels. Very good. Hello, Jeremy. Hello, Lisa. Thanks for watching. So yes, Lynn is a trooper and is doing a great job, but are you feeling any pain, Lynn?
No, none at all.
Okay, very good. Behind the ear, please. Perfect. Thank you for watching and thank you for sharing. And because Lynn has been so generous to let us share her procedure, please do share her procedure with your friends to let them know, hey, this is possible. Because people today are confused about their treatments. They don't know what's available. And like I said earlier, I had a patient we saw today who had spent $16,000 on treatments, felt she got no result. So you don't want to let that be you, spending the money and saying, wait, where did my results go? Make sure you go to someone with a proven track record and do your homework first. Very good. Peggy says she's going to do this when she gets past the next bump in the road. We'll come in for a consultation so we can give you a plan. I've had patients tell me they were waiting years for the right time, but we actually have ways to do it sooner for some people, suture. So don't wait for too long. You'd be amazed how flexible we can be. So now I'm doing the 2.0 vicryl deep suture. The key with making the scar line as small as possible is that you get the skin edges very close to each other. Okay. Perfect. So those edges come together very nicely. And then we trim right down on the knot. We will be rebroadcasting in a little bit, so make sure you are following. And again here, right on the superior aspect of the tragus. Perfect. So we're stitching this down so that way the skin edges are where they need to be. And then we'll do a 5.0 chromic to suture, please. Suture scissors. Okay, thank you for sharing, Peggy. Hope that your procedure goes well with your implants. And, definitely take care of first things first. And when you're ready, we're here for you. Perfect. So this is another deep suture. And as the saying goes, measure twice, cut once. Very good. Thank you for watching and thank you for sharing. Perfect. We will be rebroadcasting in a little bit, so make sure you are following and you get the alerts. So I must have done 1,000,000 stitches in my life, truly, because each lift we're doing few hundred little passes here, 4,000 lifts, plus all the other procedures that I've done. I mean, it adds up. And now I'm going to trim around the tragus. Actually, I like where that is, so I'm just going to trim just a little bit here. I like to fuss over these little details. So now we're doing the 5-chromic suture. Thank you for watching and thank you for sharing. So this 5-chromic, it dissolves on its own, it falls away, we don't take them out. And if it bothers a patient or they want them out sooner, we can, but usually they just fall away on their own. Very good. Perfect. Okay, so now we're in the pretragal portion of the incision, or the preauricular I should say, and now we're in stitching the posttragal area. For the physicians and students that are watching, can you feel a little pinch there?
No.
Okay, good. Everything's looking good, you're gonna love it. Of course, we cannot be held responsible for any behavior Lynn engages in when she looks younger. But she'll behave. Lynn is always so well behaved.
My mother was still alive, just
That's funny. We have a question in Spanish. Se llama de procedimiento es de cirugía de cara, de facelift, no estar facelift total, es ImageLift facelift. Mi clínica, hablemos español, llamar la clínica, 813-463-9245. Si tú tienes más preguntas. So I can see, I'm going to trim a little bit more. Okay, perfect. Perfect. So I'll put a few extra stitches around the edge of the earlobe. If the earlobe gets separated, that's easy to take care of, but we recommend that you don't wear shirts that pull across your earlobes. When the shirts come off and on, you need to be careful for that. You need to pull that all the way. Someone asked what medication do we give before the procedure? We give the antibiotic, we give the Valium. Make sure patients feel comfortable. We have anti-nausea medicine that's if needed, and we use the hydrocodone for pain afterwards. I tell patients to check to see if they need a pain pill every couple of hours, because if you sleep for 6 or 8 hours in a row, you don't want to get behind in the pain medicine. Everything's looking good. few more stitches here, then a few stitches on the other side. Perfect. We're at the posterior limb of the postauricular incision. Good. Okay. Lynn, how you feeling?
Okay.
Everything's looking good. A few more stitches, then we'll move on to the other side. Okay, here we go. So thank you all for watching. Now you can see how nice and smooth her jawline is. Of course, as we say, you don't want to taste the chocolate cake before it's done baking because this isn't the final result. But you can see what a difference it makes when we're tightening things up, and we're very proud of Lynn, looking really good. Thank you, Lynn, for letting us share, and we're gonna start the video again here in just a little bit. On the other side, we'll see you all in the next video.